Hi, today we are going to discuss regarding minor disorders of newborn and its management. What is this minor disorders or minor elements? Disorders or minor elements are nothing but it's a physical condition in which there is a disturbance of normal functioning. Means minor elements or minor diseases nothing but in newborns what it will happen, some changes in the physical condition. Changes in the physical condition will disturb the normal functioning of the newborn system. That one we will call minor ailments or minor disorders. So minor ailments or minor disorders is nothing but it changes in physical condition in which there is a disturbance of normal functioning. Next, what are that? First one, stuffy nose. What is this stuffy nose? Stuffy nose is nothing but congestion of nose will cause mouth breathing and excessive air swallowing. That one we will call stuffy nose. For example, if our nose are stuffy or stuck, what it will happen? We are unable to breathe through nose, so we will take breathing from the mouth. Next, what are the treatment for this? Treatment like we have to clean the nostrils by cotton wool soaked in normal saline, and we can use nasal spray or drops. Next one, sticky eyes. Sticky eyes is due to chemical irritation or bacterial infection like staphylococcus. Means sticky eyes will happen due to some discharge from the eyes, mainly happen due to infection or some chemical irritation. What is the treatment? Treatment like erythromycin 0.5% ointment we can use 6 hours for 7 to 10 days. So erythromycin 0.5% ointments we can use every 6 hours for 7 to 10 days. This is sticky eyes. Next one, skin rash. Skin rash is nothing but small patches usually in the napkin areas or groin, axilla, face, legs and back. It is pink in color, sometimes it's swollen or sometimes it has small pimples and patches. What is the treatment? Treatment is frequent care. Frequent care, for example, I told it's under napkin areas. What you have to do? Napkin frequently have to change and you have to keep that area dry. And you have to frequently change the napkins and you have to clean that area and you have to dry that area. Like you have to take frequent care of the child. Next, oral thrush. Oral thrush is nothing but it's a fungal infection characterized by white patches in the mouth and tongue. You can see oral thrush, it's mainly happened due to fungal infection. That how it look, white patches on the mouth and tongue. How to treat this? For precautionally, if mother having any vaginal candidiasis infection, you have to treat that during pregnancy period, and after each feed given to the child you have to clean the baby's mouth and mother nipple. Next, neonatal jaundice. Neonatal jaundice is nothing but it's a yellow color skin usually appearance on the face, chest and abdomen and legs. This neonatal jaundice maybe it is physiological jaundice or pathological jaundice. Usually in the normal children the physiological jaundice will occur. Pathological jaundice it's due to some causes, but physiological jaundice it's a common. And if the baby with physiological jaundice, there may be yellow color of skin on the face, chest, abdomen and legs. What will be the treatment like? Usually it will correct itself, and you can keep the baby under sunlight, or if it is not correct, you can keep the baby in the phototherapy. Next, engorged breast. You can see the baby's breast is little engorged. It mainly happen due to maternal hormones. So for this, no treatment, but you should not squeeze the breast. Next one is vomiting. Vomiting will mainly happen due to fault in feeding techniques or some other conditions like stenosis, intestinal obstruction, or infection like UTI. But how to prevent this vomiting? Proper techniques of breastfeeding and proper positioning, and you have to avoid bottle feeding. Next, diarrhea. Diarrhea mainly happen due to intake of maternal medicines like ampicillin or any other drugs. And we have to avoid bottle feeding, and we have to wash the nipples after and before feed. Next, neonatal constipation. Neonatal constipation is mainly happen due to insufficient fluid or milk intake. It's the neonatal constipation mainly we can see in the bottle feed infant. And management like milk of magnesia 1 teaspoon twice a day, and we have to apply lubricant over the anal region. Next one, sore buttock. Sore buttock mainly happen due to frequent loose motions and maintenance of poor hygiene. What will be the treatment? Treatment like we have to change the position of the baby time to time, and we have to apply coconut oil, and we have to put the baby in lateral or prone position. Next, hiccups and sneezing. Usually these hiccups will occur immediately after the feed due to stomach distension and irritation of diaphragm, and this sneezing will occur due to irritation of the nostrils. Next, failure to pass the meconium. Usually the healthy babies will pass urine and meconium within 24 hours. Meconium is nothing but first stool passed by the baby which it is in dark green color. If baby does not pass the meconium, you have to inform doctor immediately. Next, excessive crying. Excessive crying is mainly due to hungry or discomfort. Sometimes it may be due to full bladder and before passing urine, or in constipation or insect bites, some other reasons. Treatment like frequently have to feed the baby and check the urine and motion, and cover the baby from the insects. Next, excessive sleepiness. Excessive sleepiness is due to sedation given to the mother at the time of labor. Some babies will sleep after a few suck of milk. The baby should keep abused during feed, tickling on the soles and behind the ears. Miss, what you what you have to do means, while feeding time, what it will happen, with few drops the baby will stop to take suck. So that time what you have to do, you have to make it arouse by tickling on the soles or behind the ears. Next, caput succedaneum. We already saw this caput succedaneum in last class. It's a boggy diffuse edematous swelling of the soft tissue on the scalp. Usually it will come to normal in few days. If not come to normal, you have to consult doctor. Next, umbilical granuloma. Umbilical granuloma is nothing but infection occur in the umbilical region. Here what it will happen, umbilical cord become moist and may be swollen and it will ooze or bleeding. Treatment is nothing but Silverex nitrate ointment. You can see here, usually we will cut the umbilical cord and we will clamp, and within some days it will try to get off from the umbilical area. Itself only come out. If not come out, that may cause infection. Next, pink eyes. Pink eyes is nothing but conjunctivitis. In pink eyes, it's have yellow discharge along with red irritated looking eyes. Treatment like cold compression, and we have to apply antibiotic eye drops. Next, baby acne. Baby acne mainly due to pregnancy hormones which stimulate oil glands. Treatments like wash the baby face with mild soap once a day. Next, genital crisis. Genital crisis already we saw. Vaginal bleeding in female baby and hydrocele in the male. Or mastitis neonata means infection of the breast. This vaginal discharge or bleeding may occur in female infants. It's look white mucoid in color. The bleeding may be result of withdrawal from maternal hormones during time of the birth. It's usually few blood spots on the diaper. And it's not terminates within 2 days, you have to consult doctor. Next, diaper rash. Diaper rash we can see as redness on the baby's genital area and buttocks. Generally, the mild rash can be managed with topical creams. Some diaper rash need medical attention. Maybe it's due to bacteria and fungal infection. Causes of diaper rash: friction with the diaper, prolonged use of wet diaper, sensitivity to chemicals, bacterial infection, candida infection, or dietary factors. These are causes of diaper rash. Next, how to avoid diaper rash. You have to clean well, you have to wash with careful, and you have to keep the diaper loose, and whenever soiled diaper is there, you have to remove instantly. These are the 5 ways to avoid diaper rash. This is regarding minor disorders of newborns.